Today we've got Lesley James, who's a senior manager for policy at the Heart and Stroke Association, an amazing organization that I've had the privilege of working with. And as many of you know, in our riding, we've held 3 roundtables on youth vaping going back, oh gosh, the first one was pre-COVID. That's how long we've been doing them. And one of them, we were fortunate enough to have Heart and Stroke join us to share their data. Over the last couple of weeks, I've been the subject of quite an extensive social media attacks because of the stand that I've taken on youth vaping. And so I invited Lesley to join us today just to talk about the facts, because I know in my riding of Oakville, North Burlington, and in Halton in general, all levels of government have been concerned about this and taking action. So, Lesley, thank you
Thank
for
you for
joining
having
me.
me.
Maybe we can talk a little bit about the rise in the number of youth who are vaping, and I'm sure you've got some stats on that.
Yeah. So since legalization, which happened in 2018, we've seen a steady rise in youth vaping. The most recent data shows that about 20% of young people in grades 7 to 12 are current vapers. Now, this is much higher than in the general population and in the adult population, where it's about 4 or 5%. So most vapers in Canada are actually young people under the age of 25. And the rates get higher as the age segments go up. So those in grade 7 to 8 and 9, it's lower. When you reach the later years of high school, it's about 30%. And this is very concerning. So something that started off as a device to help smokers quit has actually infiltrated youth culture. And it's now led to a new generation of young people addicted to nicotine who otherwise wouldn't be. We know that the rates of tobacco use are going down in Canada, but the rates of vaping have gone up, and it's a crisis. It's very concerning. Heart and Stroke has been working on this file since about 2014, and that's before legalization. So we saw these in Canada in the marketplace before they were legalized by the federal government. But once legalization happened, it really opened the floodgates for a number of companies, a lot of marketing, and easy access for young people. So I thank you for taking leadership on this, and hopefully we can address the issue and really protect young people from the harms of vaping.
Well, I was mentioning this before we started recording, but I know before the federal government banned ads by the vape companies, I went to a Raptors playoff game, and every square inch of Union Station was wrapped for either Juul, I think it was Vape actually. And at the same time, I know Juul subsequently got rid of their Instagram account, but they were on Instagram with something called Vape Tricks. By the time they left, that culture had been so ingrained in Instagram that it didn't really matter that they were on there anymore. They had created a culture, and it was specifically aimed at young people. It was on Instagram, people posting vape tricks. So from my generation, for those that are watching, if you don't know what those are, think of elaborate smoke rings. So when people used to be able to blow smoke rings with a cigarette, only these were 100 times more elaborate. So that culture was specifically developed on Instagram, where more young people were. And I wonder if you could talk a little bit about the way these companies have targeted youth and some
Yeah.
of the tactics that have been used.
So when these companies first came into the North American marketplace, they really used marketing campaigns that were appealing to young people. So bright colors, really attractive young models, vaping, and having fun at parties. They had a lot of events throughout Toronto with really attractive models, maybe not in a lot of clothing. There was a wide variety of tactics, and the same tactics that the tobacco industry used decades ago to really entice people to this new age of freedom and expressing yourself, trying flavors. It was socializing too, right? You're with other people and you can share your vapes, you can try different flavors, you can do cool tricks together. It was really a strategy right out of the tobacco industry playbook. And a lot of these companies have since been bought up by tobacco companies. So now they have millions and billions of dollars to help with the marketing strategies. But we just spoke about this earlier. This wasn't targeted towards smokers. When these devices first came out, they were marketed to general population. And of course, with these attractive ads and colorful ads and attractive women promoting these, you're going to get young people interested in trying them. And because they were so easily accessible, young people tried them, became addicted to them, and now we're facing the consequences. So years later, we still have young people who haven't been able to kick the habit. It's not a habit, it's an addiction now. And we're suffering the consequences. So, we went into this thinking perhaps it would be a great option for smokers looking to quit. It still might be, but we need to, pull back and make sure young people aren't using these products. And we know exactly what policy measures we can use to make that happen. We've learned from tobacco. We've had great successes in tobacco, and we need to apply those lessons now.
Well, I remember working with the Canadian Cancer Society years ago to try and get this flavored chewing tobacco and different flavored tobaccos off the market, because again, it was being marketed to young people. And I guess I've found it really frustrating, because I had a voicemail just today, someone saying that the government went into high schools to promote vaping and teach kids vape tricks. That's simply not true. And in fact, I had a pediatrician who came to the first roundtable we had, who said he's seeing kids 10 to 12 who are addicted to vape products. Nicotine is addictive. It may not have as many chemicals when you vape as a combustible cigarette, but nicotine is extremely addictive. And so these young kids at 10 to 12, he doesn't have anywhere to send them to help them quit, because there are no quit. All of this, the smoking cessation programs and that type of thing, they're all geared to older adults and to a lesser extent teens. But a 10-year-old, there are no programs, and he's seeing more and more in his practice. So when I have these attacks on social media saying that youth vaping is not a problem, and that I should be talking to the vape shops, I know in Oakville, two vape shops are located right near high schools and have been repeatedly fined for contravening regulations around who they're selling their vape to. Now, kudos to the town of Oakville and Councillor Jeff Knoll, who brought in a licensing program for the vape shops in the town of Oakville. But it must be frustrating for you and for Heart and Stroke to have felt like you were winning the war on cigarettes, and now seeing a whole new generation come up who are repeating the mistakes of the past, only this time with vape.
Yeah, it's very disheartening, and your story about a 10-year-old being addicted and there not being the right programs in place to help, it's really heartbreaking that we've failed our young people this much, and let them become addicted and get to the point where they can't, quit this social habit because it's now an addiction. Those people who say, youth vaping isn't an issue. My husband's a pediatrician. He sees it every day. He sees the addiction. I grew up in Hamilton. My mom's a teacher there, and she sees on the playground youth vaping. So, we see it firsthand, and we have the data. We have the numbers of these surveys from Health Canada and Stats Canada, which don't lie. I don't think youth are going to lie in these surveys and say they're vaping when they're not. They don't want to get in trouble. And in fact, the rates could be even higher because people might not disclose if they are breaking the rules and vaping underage. But yeah, it's been very awakening for us at Heart and Stroke to see this new crisis unfold. We started working in this field in 2014, and at that point, we weren't quite sure what the harms of vaping would be. We were apprehensive, taking a bit of a precautionary principle, and said, if we're going to legalize these, let's make sure we have some parameters in place to protect young people while still allowing adults the option to use the devices. Once 2018 hit, it was like the Wild West. It was bigger than anyone could have predicted, and the rates just skyrocketed. The rates of youth uptake of vaping are, more expedited than we've ever seen with tobacco. So it's just, I think, people were well intentioned in hoping that these devices would be kind of a saving grace for the tobacco epidemic. But unfortunately, we opened the floodgates too fast, and now we're paying the price. But the good thing is, Heart and Stroke has learned so much from tobacco control, and we've worked with our partners for so many decades, the Lung Association, the Cancer Society, and we know what measures brought down tobacco use in Canada, and we can apply those same measures to vaping. And we're not trying to ban vape devices. We get attacked quite often saying that we're trying to ban these devices. If you're a smoker and if you've switched to vaping products and you've been off tobacco, it's fantastic. We hope that you can get off vaping devices eventually, because no one is meant to be inhaling anything other than clean air into their lungs in the long term. But our issue isn't with adult smokers. Our issue is with young people, so people who are underage, and then people at 25 and under, because that group is really experimenting with these products and becoming addicted. And that's an age group that wouldn't otherwise be smoking. So we have a lot of work ahead of us.
And that's something that people keep posting, that kids are going to smoke cigarettes if they're not vaping. And I know for a fact that in fact it's something that yourself and partners have been so happy about is the reduction in the number of kids smoking combustible cigarettes. In fact, I remember when my son was in high school, it had become socially unacceptable for kids to smoke. So, I mean, is there any truth that kids are going to smoke cigarettes if they can't get access to vape?
No, definitely not. The rates of youth smoking have gone down each year in Canada, and we're very grateful. And a lot of it stems from the work of the federal government and the provinces and municipalities like Oakville taking, strong measures and recognizing what needs to be done. Youth will experiment. There's no denying that, but they'll experiment with things that are easy to access, and vapes are easy to access and being promoted, and it's created this youth culture. So if they're going to experiment with anything, it's going to be vape devices because they're more accessible. I've talked to a lot of young people also, and there is this mentality that tobacco is passé. Like, ooh, why would you smoke? It smells bad and it sticks to your clothes, and oh, it's so bad for you. It's so harmful. But they don't see vapes as harmful. A lot of people think it's just flavored water that's being you can do tricks with, and it really doesn't have much, there's nothing sinister to it, when that's far from the truth. We know these products are likely less harmful than tobacco, but they're definitely not without harm. And we can't quantify and say what the harm is yet. So you might see a lot of statements saying it's, X% less harmful than tobacco. Well, they haven't been around long enough for us to know that. It took us decades to figure out just how harmful tobacco was. So how do we suddenly know how harmful vapes are within 5 years of them being legalized? It doesn't make sense. So we really say at Heart and Stroke, if you're a smoker and you need to quit and you haven't been able to quit otherwise, sure, try vape devices. If you're a teenager or a young adult and you've never used tobacco, there's no reason for you to start vaping, because the harms outweigh any benefit that you're going to see with social interaction or the fun tricks that you're going to get to do. We worry about what happens 10 years from now with the rates of lung disease and increased rates of cardiovascular risk that we likely will see from young people using these vape products.
And one of the things that I've really liked about what we've done with our roundtables is we've had federal, provincial, municipal government, as well as the school boards. We've had public health there to try. When I initially brought folks together, it was because no one level of government is responsible for everything. And if we can get everyone together in a room, figure out the gaps, it's been really quite productive. And as a federal government, what we're looking at is lowering the minimum nicotine level. It's currently, lowering it to 20. Now, some provinces have already done that, but this would be provinces can do more, but they can't do less. So we're looking at lowering the nicotine level of banning flavors except for tobacco, mint, and menthol, and we're not looking at banning e-cigarettes. So the uproar seems to have to do with the flavors, which we know tobacco companies use to target kids in the past.
Yeah.
And so with cigars, with you know, it's a way to suck kids in. So thank you for what you're doing.
Thank you. Well, thank you for taking a leadership role in this area. And like you said, it needs to be coordinated between all levels of government. It's not, one government's responsibility to take this on. And we learned from tobacco that it needs to be multi-pronged. It needs to be local, provincial, territorial, as well as federal. And we're so pleased with the nicotine regulations that have been put forth by the federal government. Capping nicotine content at 20 milligrams per milliliter will align us with most of the developed world. Canada had, really high rates, and those high rates came in around the same time that these pod devices came in that were targeted to young people. So even with a limit of 20 milligrams, we know that adult smokers can still use them to their benefit. They can adjust the settings to be able to vape, how they please and get as much nicotine as they need from these, but it will really prevent the devices that are appealing to youth from being super high in nicotine and that much more addictive. So we're very grateful for that. And with the flavors piece, you're absolutely right. We know that tobacco companies use flavors to entice young people, and we need to limit the flavors that are on the market. So looking at what young people use versus what adults use, that gives us a really good indication of where we should head from a policy lens. We don't need the thousands of flavors that are on the market now. We don't need watermelon madness and unicorn puke and cotton candy cascade and whatever it might be. Those are targeted towards young people. Adult smokers need a few options to help them, switch off. But I also want to mention too, so the biggest trend in terms of vaping right now is dual use. So that's someone smoking and vaping. So they haven't fully substituted. There's a lot of emerging research showing that people who are using both vape devices and tobacco are actually at the highest risk for cardiovascular disease. So they have a 5-fold increased risk of a heart attack and 3-fold increased risk of stroke. So it's very concerning to us. So, if you are using these devices, switch fully. Don't be using them, in social settings where you aren't allowed to smoke and vape, in those settings, and then smoke where you can elsewhere. If you're going to switch, fully substitute, and there will be flavors available for you to use, but there won't be hundreds available. And that's just the reality that we have to endure to protect young people. And I understand there will be some backlash, but it's for the greater good. And that's what we want to keep reiterating.
Awesome. Well, thank you and your team for everything that you're doing on youth vaping and so many other other really important issues. You've done a lot of work around women's heart health, and I just think your organization does. Canadians benefit so much from the work that you do. So thank you so much.
Well, thanks for speaking with me today, and thanks for your leadership. I really appreciate it. Take care.